Hello class, my name is Daryl Rooks and this is my gait development presentation for Kinesiology 322. Humans have very long careers as walkers. Once the ability to walk proficiently is achieved, the technique will rarely change. Haywood and Getchell define walking to be a 50% phasing relationship between the legs, as well as a period of double support. This is when both feet are on the ground, followed by a period of single support. Our gait cycle goes through many changes as we age. During our toddler years, we slowly learn our perfect walking gait. Haywood and Getchell also state that by age 4, most children have the essential ingredients of an advanced walk. In early childhood, there are many common characteristics of a toddler's walking gait. They take independent steps, they have very short stride length with little to no leg or hip extension, they have flat feet, and their toes point outward. The arms tend to stay in a high guard position, and the toddler lacks trunk rotation. This can be seen in the photo right here. The child has stiff legs, and each step is independent of the other one. The arms stay in a high guard position, and he lacks a good center of balance. This stage of the gait cycle is the most difficult. The toddler has not yet developed a sense of balance and lacks a base of support. The limbs are barely grown, and the muscles are weak still. Before a child even begins to walk, they must obtain enough strength to support and move themselves and must uncouple their limbs, which have primarily moved in unison and in the same direction. Each baby will develop strength in different muscles and at a different rate. Limb length and weight have a heavy influence on how fast a baby can progress towards walking. The number one abnormality in children is Down syndrome. Haywood and Getchell state children with Down syndrome often experience delays in motor milestones. Physical constraints in early childhood can consist of many things, including limb length, obstacles in the environment, and muscle strength. As the children grow and progress into early childhood, their gait cycle begins to change and resemble that of a full-grown adult. Their stride length increases as their limbs grow. They are able to apply a greater force of application and leg extension and perform push-off better. Children develop a heel, then forefoot pattern, which results from an increased range of motion. The toes begin to rotate inward, and the base of support actually narrows. Their balance improves, and forward trunk inclination is reduced. Arm swing becomes oppositional to the legs, but it's not quite relaxed yet. Pelvic rotation that enables full range of leg motion, as well as upper and lower body segments, begins to develop. As the child continues to grow, the walking gait will continue to improve until it nears perfection. Antalgic gait may occur in children as they grow. This is described as attempts to avoid putting weight on one leg due to pain. If the patient is walking, he puts as little weight of the affected extremity as possible for the shortest time possible during the stance. Sometimes this is simply attributed to an injury, but it also can be attributed to growing pains. Physical disabilities such as obesity in a child or injury, like stated before, can cause constraints in the walking gait. Obesity causes excess weight, and therefore there is difficulty in maintaining balance and body control, resulting in obese people taking shorter and wider strides than their leaner counterparts. By adulthood, we have reached our walking gaits at a level of perfection. Our bodies have had ample time to learn to control our balance and coordinate our upper and lower half. At this point in walking, we are able to complete everyday tasks with ease, and there should never be an issue. Gait analysis between healthy adults rarely varies. The big differences come whether they've had injuries in the past or they have other physical constraints. A normal gait cycle, according to Dr. Bogey, consists of stance and swing phases. The stance phase further subdivided into 3 segments. It includes 1, the initial double stance, 2, the single limb stance, and 3, the terminal double limb stance. According to the CDC, more than 1/3 of the US adults have obesity. Obesity has been directly related to the waddling gait, and just like children, it affects how we walk. This is by far the most common abnormality in the gait walking cycle amongst adults. They are forced to take steps like penguins. due to the shift in the center of balance and the increased stress on their joints. Other constraints include injuries to the nervous system. That can be from physical injuries, or it can be from neurological diseases. The paralysis of limbs that can come from, again, physical injuries or sometimes stroke. And we can also have partial blindness that affects our perception rate. As we age, our bodies adapt, which is evident by the statement, changes in walking patterns seen in older adults represent a recalibration to the environment and the task based on changes in individual constraints. It's nearly impossible to simplify the changes in our gait cycle as we age because each case is individual rather than universal. This means, like I previously stated, that not all cases are the same as we age. One person might have an injury in the car accident, and the other might be a perfectly fit individual. Generally, though, we will notice the same few changes in the walk of the elderly. Their pelvic rotation starts to cease, ankle and knee extension diminish, they begin to toe out again, and the stride length shortens. This is very reminiscent of early childhood walking. The changes that occurred during our lifetime directly turn into rate limiters as we reach late adulthood. There are many constraints that older adults can face that include osteoarthritis, which is pain causing the person to shift the way they walk to accommodate for such pain. They fear losing balance. This causes them to widen their stance because they do not want to fall over and cause injury. Haywood and Getchell also state if older adults fall, they may develop a fear of falling. That fear of falling results in gait designed to assist with balance. This is the widening base of support and shorter step length. One abnormality in the elderly is Parkinsonian gait. Parkinsonian gait has several features including short steps, reduced arm swing, stooped posture, anteropulsion, festination, and postural inability. This is evidenced when the patient attempts to stand up without the use of his arms, and they tend to fall back in their seat. These are the references that I used for my presentation, and I appreciate all your guys' time. Everyone have a blessed night.